Welcome to this explainer, everyone. Look, if you're feeling totally overwhelmed by the sheer mountain of pediatric nursing content out there, you are in the exact right place. Today, we're taking Chapter 17 and distilling it into a rapid-fire, high-yield crash course. This is designed specifically to help you conquer your ATI and NCLEX exams. I know exactly how stressful prepping for boards can be, so we are going to make this super clear, structured, and honestly, pretty hard to forget. So what does that actually take to ace your toddler ATI quiz? Well, we are completely bypassing the textbook fluff. No time for that. Instead, we're zeroing in on the exact developmental milestones, the critical safety protocols, and those key psychosocial buzzwords that you're going to see tested over and over and over again. Grab your notes and let's get you ready to absolutely crush those exams. Here's our quick blueprint for today. We'll hit growth and developmental milestones, move into behavior and psychosocial stages, tackle discipline and toilet training, outline essential nutrition, and finish up with priority injury prevention. Let's dive in. Section 1, Growth and Developmental Milestones. We have to set that physical baseline right away before you can spot what's abnormal on a test. I want you to literally burn this number into your brain. 4. Just remember that multiplier. By 2.5 years of age, a toddler's birth weight should have quadrupled. It's a classic, heavily tested ATI data point. Test writers absolutely love asking about weight changes because, well, it's a super objective indicator of healthy physical development. So if an infant triples their weight by 1 year, the toddler quadruples it by 2.5. Easy points. Now, language development is incredibly predictable. If you want to establish a normal baseline, focus your studying right here on these 3 key ages. At 12 months, you're looking for that second word to pop up. By 24 months, or 2 years old, they should be stringing together 2-word sentences, things like want milk or go car. And by 36 months, or 3 years old, they're mastering pronouns and plurals. So if you see a question about a 2-year-old, your mind needs to immediately jump to 2-word sentences. Of course, the ATI loves testing your ability to spot when things aren't normal. So you need to be on high alert for specific speech and gesturing delays that mandate autism screening. No pointing or using simple gestures like waving bye-bye by 12 months, major red flag. Same goes for no single words by 16 months or a lack of spontaneous 2-word phrases by 24 months. As a nurse, you are right on the front lines of early detection, which is exactly why these red flags pop up on your quizzes all the time. Moving right along to Section 2, Behavior and Psychosocial Stages. Let's hit those buzzwords practically guaranteed to show up on your exam. First up is a total classic, negativism. This isn't a child just being bad. It's a completely normal developmental phase where toddlers test out their power by constantly saying no. What this means for you on an exam is that your nursing intervention should never, ever be to ask a yes or no question. Instead, give them limited choices. Don't ask, are you ready for your medicine? Because guess what? The answer is going to be no. Ask, do you want to take your medicine with the red cup or the blue cup? You're respecting their need for autonomy while still getting your job done. Ritualism is another heavy hitter you will absolutely see. Toddlers create a huge sense of security for themselves by turning simple tasks into compulsive routines. You have got to respect their strict bedtime or mealtime rituals. If you have a hospitalized toddler who insists on drinking from their specific green dinosaur cup before bed, well, you go find that cup. Disrupting these rituals causes them immense anxiety, and recognizing that is a massive part of pediatric nursing care. You also got to be able to recognize parallel play. Think about 2 toddlers sitting side by side. They aren't sharing blocks to build one big tower together. They are each building their own separate towers right next to each other. Cooperative play doesn't even emerge until preschool, so parallel play is exactly where they are supposed to be. If an ATI question tries to trick you by asking about a 2-year-old who isn't sharing, just remember, this is the totally expected social norm for this age bracket. Now, all of this behavior, the negativism, the ritualism, the parallel play, it all ties directly into Erikson's psychosocial stage for toddlers, which is autonomy versus shame and doubt. Your overarching nursing goal, and the correct answer on your exams, by the way, is to safely foster their independence. Let them try to feed themselves. Let them help put on their own clothes. We are trying to build up that autonomy so they don't develop shame and doubt about what they can actually do. All right, Section 3, Discipline and Toilet Training. This part is absolutely packed with highly testable parental education points. Let's talk timeouts. When you get a timeout scenario on the test, you need to verify that the parent is following this exact chronological protocol. First off, timing shouldn't even start until the child has actually settled down. Second, and this is the absolute most critical part, it's 1 minute per year of age. Got a 3-year-old? They get a 3-minute timeout. That's it. And finally, praise the child after they are calm to reinforce that positive behavior. Always look for that 1 minute per year rule in your multiple choice options. For toilet training questions, the secret is physiological readiness. So many parents want to rush this process, but the truth is, voluntary control of the anal and urethral sphincters doesn't even start to develop until 18 to 24 months. If an ATI question describes a parent trying to potty train a 14-month-old, your nursing education needs to step in and explain that the child simply does not have the physical nerve maturity yet. It's just biology. Next up, Section 4, Essential Nutrition Requirements. Toddler nutrition is full of these really strict numerical exam rules that you just have to commit to memory. Keep this exact number locked in your mind. 720. 720 milliliters, which is 24 ounces, is the absolute daily maximum for milk intake. Now, why is this so heavily tested? Because toddlers who chug too much milk get too full to eat their actual solid foods, and that leads straight to severe dietary deficiencies, specifically iron deficiency anemia. Milk anemia is a classic board question. Limit that milk to 24 ounces max. So, if we're limiting milk, how do we serve them solid food? To avoid totally overwhelming the kid and causing them to just refuse the food entirely, the benchmark you need to teach parents is 1 tablespoon of solid food per year of age per meal. For a 2-year-old, that literally means 2 tablespoons of peas and 2 tablespoons of rice. I know, it looks incredibly tiny to us as adults, but it is exactly what a toddler's stomach can handle. This prevents those massive power struggles at the dinner table, and any parent will tell you that is a battle you are not going to win. Finally, we've reached Section 5, Priority Injury Prevention. Safety is literally the #1 priority in nursing, which makes this a life or death exam topic. Because toddlers have this sudden newfound mobility, an intense curiosity about everything, and absolutely zero mature judgment, accidents and poisonings are the undisputed leading causes of death for this age group. Think about it. They can open doors now, they can climb onto chairs, and they still explore the world by putting literally everything directly into their mouths. Keeping this reality in mind helps you correctly prioritize preventative care in your nursing assessments. All of this makes parent education regarding home safety absolutely paramount. We're talking about active visual interventions like child-proof latches on drawers and cabinets to block access to household hazards. Just telling a toddler no is nowhere near enough. Their physical environment literally has to be modified to keep them safe. On your quizzes, you have to be ready to identify the correct nursing interventions for specific hazards. You need to know to teach parents to turn pot handles toward the back of the stove to prevent terrible burns. You absolutely must ensure that all medications, yes, even vitamins, are locked away out of sight in a cabinet, not just pushed toward the back of a bathroom counter. Hot liquids need to be totally out of reach, meaning no tablecloths with overhangs that a toddler could easily pull down. And of course, always reinforce the appropriate use of car seat restraints. As you pull all this high-yield review together for your exam, I want you to anchor yourself to this one core NCLEX concept. Discipline for the toddler should be designed to teach rather than punish. Literally everything we do for the toddler, from offering them limited choices, to respecting those quirky rituals, to fully child-proofing the home, is all about safely guiding and teaching them towards self-control. Keep these high-yield points fresh in your mind, and you are going to absolutely crush those pediatric questions. So I'll leave you with this to chew on. The next time you see a toddler throwing a massive flailing tantrum in the middle of the grocery store, ask yourself, are they actually being bad, or are they just deep in the throes of Erickson's autonomy versus shame and doubt? Thanks for studying with me today, and you've got this.